Thank you. My name is Donna Rizzo. I'm in the Civil and Environmental Engineering program at UVM and a Fund Fellow. I'm going to spend the next few minutes talking about identifying model structure and scale dependencies. And the particular application I'm going to be talking about is Chagas disease. My background is really groundwater modeling and surface water modeling. It's a huge collaborative grant. We're only in the second year, just started the second year, with other folks at UVM in biology. We have collaborators at Loyola University, the University of Guatemala, and we just have some new collaborators from Honduras and El Salvador. The overall research goal, my part of the overall goal, is to develop new geostatistical tools that basically can analyze all the limitations you experience with large data sets, termed big data. And I think you're going to understand why this particular application is perfect. It's Chagas disease. Why should you care about it? It's endemic to 21 Latin American countries. Approximately 8 million people already are infected with the disease. 30 to 40% of those people will actually die of chronic Chagas, enlarged heart or esophagus, and there's no preventative medicine or vaccine. It's now in the United States, southern part of the United States. It's in our blood supply, and as of 2 years ago, we test for it. So here are my conclusions. I can't talk, I didn't feel competent telling you about these new geostatistical tools in the time that I had, but basically, there's no such thing as correct scale. It's problem dependent and it's data dependent. And the key in the tools that I develop are being able to recognize when a change in scale is actually occurred, to be able to identify what information and what scale that data must be collected, and then to model all of the components that go into some sort of risk map at the appropriate scale, so that we don't have to select a model that has one particular grid size or temporal scale. Now I'm just going to talk a little bit about the data set. You're going to see why it's beautiful. It's already a 15-year data set, mostly due to our collaborators in Guatemala. Everything's geo-referenced. We have genetic data already in the Specify 6 database. That particular bug in the middle is the vector. It actually carries a parasite. We know the infection, we know blood meal sources, age and sex of the bugs, all the demographics of the inhabitants. In every single house in 25 villages in Guatemala, tracked over about a 10 to 15 year time frame. Presence of electricity, the house condition, hygiene, chicken coops, animals, whether they move in and out of the house. And what we're adding to this over the past years is genetic SNP data, and it's going to basically be able to tell us, or we actually already know at the end of this year that it will be able to tell us how the bugs are related to each other, how many blood meals they've actually fed on it at the household level, and our preliminary statistics. All the traditional things that you would already see, we can rank a lot of the variables, basically hygiene and bedding, and the cracks in walls are huge indicators of whether the house is going to be at risk. We already knew that. All this data already gave us probability distributions, so we've done a bunch of hierarchical Bayesian modeling, and we've found some really neat initial correlations to land use. Unfortunately, we're not collecting enough data on the crops. There has to be something key to coffee in some of these villages. So if anybody's interested in that, I'd like to talk to you at the break. And lastly, we already have an SIR model developed for the household scale. The idea is, and it's already been calibrated so that we can look at the effects of disease spraying on the houses, and we can also look at these eco-health interventions that our collaborators actually put in place that plaster the walls and cement the floors of people's homes, move chickens outside of the houses. We're basically going to replicate that model at every single house within these villages, and then use this genetic data to actually look at the dispersal rates of the disease as it spreads and moves from house to house. It's an extremely shy vector, and I'd be happy to talk to anybody at the break. Thank you very much.